So, Irene, you are originally here from Mukuru, Sinai, and you have started to learn or to become a nurse.
Yeah.
You have started your studies 1 year ago.
Yeah, 1 year ago.
And can you tell us a little bit about why nursing, nursery, and why caring, and how is the situation of health here in the slum areas, but also in the hospital where you do your education?
Okay, the reason as to why I chose nursing as a career is because I realized in where we live here, Mukuru, health is at risk. Most of the mothers do not get the attention they need during the antenatal, and most of the people are experiencing certain disease that they don't know their whereabouts, and they cannot explain themselves when they go to the hospital. So I decided to do nursing so that I can create the awareness here and teach women and men both hygiene from my understanding, because I can talk to them with their language that we both understand each other.
Mm-hmm. Can you explain a little bit what kind of professional education you do now with these studies? I mean, what are the modules? How long does it take? What do you learn? Where do you learn?
Okay, I started with a certificate in CNA, which is a certificate in healthcare assistant. We were doing safe motherhood, palliative nursing, general medicine, pharmacology. Later on, I upgraded to doing psychology, which I'm doing mental health. Now I have the awareness of certain mental health conditions that most of our people are experiencing here in slums, but they cannot explain themselves. I'm doing my course in Nairobi Women's Medical Hospital College, which is located in Kikuyu, and the course takes 3 years.
Mm-hmm. And afterwards, you are a certified nurse?
Yeah, I'm a certified nurse and also a certified psychologist.
And this means you can, for example, then work also in a national hospital?
Yeah, I can work in a national hospital with the nurses, doctors. I can work in a mental hospital and in a rehabilitation center.
Do you have already an idea what you want to do once you have done your exam? In which kind of unit, for example, or in which direction? Maybe also here in the community. Where do you want to work?
I would like to work in a hospital, mostly in the palliative unit. Also, I would like to work back in the slum in a rehab where I can educate people more on mental health conditions.
Where do you see the biggest needs in the health system here?
The biggest need is in mental health awareness and in safe motherhood.
Mm. And many people don't have, let's say, health insurance, right?
Yeah, true.
So how do people deal with diseases? What's happening if someone feels unwell? Can he go to the doctor, to the healthcare professional, or can you explain a little bit what's happening to people who need a doctor and have no insurance?
Okay, most of the people opt to buy medicine that they can afford of like 10 shillings, and most of the people don't have insurance card or medical covers. So we have public hospitals, but they don't have medicine. Most of the people just stay like that at home.
So no way out.
No way out for most of them.
Okay. Mm-hmm. And here in the slums, you have also clinics, right?
Yeah, we have clinics. Some of them are community based, which they charge a small amount, of which most of the people still cannot afford to pay that amount, and most of them others are private.
Mm-hmm.
Yeah.
You have also faith doctors. Can you explain what this is? And
okay, faith doctors, you can say they are like, here we call them nyumba kumis. They are basically here in the village. You can go talk to them. They pray for you, and no medication. And most of the people, they still don't have the awareness of medication. Most of them, they are religious. They don't take medication.
So who's normally going there? Is it more the elderly, or those who have no money at all? Is it the last hope approach?
Most the elderly who Actually, here the elderly are most neglected, and those who don't have money at all.
How would you imagine health to become here in, let's say, in the area where you live? What would be a perfect thing?
A perfect thing will be a good clinic which has doctors, nurses, medication, and other medication, and also it should have like the inpatient that won't charge a lot of money, and we should also request if we can have specialists like the cardiologist, the neurologist, and other patients like the opticians for those who have issues like we have also patients who need dialysis but they cannot afford the money for dialysis.
Yeah, and my last question would be, so what are your ambitions? You said you want to do the exam, you want to become a nurse.
Yeah.
You want also to give back to the community?
Exactly.
Yeah. What about fake medicines? Maybe here just some last information. How do you look at it? There's a lot of fake medicine here, or is it not an issue anymore?
It is there, and it is, most of the people don't know if it's fake, because here in slums you have a lot of illiteracy. They don't have most of them don't know how to read, so they cannot tell if the medicine is genuine or it's not. They don't have the awareness at all.
Irene, all the best to you.
Thank you.
Yeah, to your studies and to you personally, and keep doing your good work for the community. Thank you.
Thank you so much.